Hello, and welcome to the Real World Dry Eye video series. I'm Dr. Jason Miller. I'm in a typical family eye care practice in Central Ohio. I've been working to grow my dry eye treatment center for the past 15 years. I'm excited to show you some of the things I've learned so far. Today is our first program, and I'm focused on identifying that dry eye patient. Let's go see. Identifying a dry eye patient starts at the front desk. Maybe our patient looks uncomfortable or is carrying eye drops with them, or perhaps they indicate there is a problem on their intake forms.
Thank you, Melanie. I'll go ahead and take you back to the pre-testing room now.
Okay.
So, Melanie, what brings you in today?
Well, I think my contact lens prescription has changed because my eyes are getting irritated. And sometimes my vision blurs when I'm on the computer.
Okay.
And then I've also been using these drops, but they don't seem to be helping either.
Okay, Melanie, let's get a couple more tests done before we bring the doctor in. How's that sound?
Okay.
Okay.
First, Kirsten is going to use the autorefractor on Melanie. Do you notice the blurry mires? This may be indicative of pathology on the ocular surface. Next, she will move along the line and do a visual field test. Once they move into the exam room, Kirsten will test Melanie's blood pressure, eye pressure, and visual acuity. Do you see her blinking a lot to focus on the images? This is further indication that there may be an ocular surface disturbance.
Dr. Miller, your patient Melanie is ready to see you.
Thank you. Hi, Melanie. I reviewed your chart and your initial test results. I'd like to take a look at the health of your eyes now.
Great.
Melanie, do your eyes ever burn, itch, feel dry, or uncomfortable throughout the day?
Yeah, sometimes.
Are you bothered by red eyes?
Yes, especially at night.
How often do you use those eye drops you told us about earlier?
Oh, 2-3 times a day.
Are you taking your contacts out earlier in the evening?
Yeah, I can never keep them in past 5 or 6.
What's the main reason you take them out so early?
My eyes get tired and dry, and it becomes hard to focus.
Well, from the clinical signs I'm seeing and from your symptoms you're experiencing dry eyes. And that's a common condition in today's digital world. I want to show you what you're experiencing. Do you have your cell phone with you?
Yeah. What does dry eye mean? Do I need to do anything about it?
Poor ocular surface health results in poor visual acuity. Think of your cornea like the windshield of a car. If that surface dries out, your visual quality decreases, resulting in increased visual fatigue and lower productivity throughout the day. Dry eyes are a serious problem. You may be tempted to provide your patients with a grab bag of artificial tears. Don't do that. Choose the treatment that is best for your patient's condition and show them exactly what it looks like and where they can find it in the drugstore. It is important to treat the source of the issue rather than providing temporary relief. Besides, failing to treat the issue will often lead to a feeling of indifference from the patient's perspective. In fact, a 2008 Gallup study of 751 dry eye sufferers found that a whopping 97% were frustrated with this condition. Here's how you can help your patients with dry eyes. First, focus on early prevention and treatment. It starts with classifying the patient with which level of dry eye disease they have, whether it's mild, moderate, or severe. For example, if this patient has no symptoms, but they do have clinical signs, you will want to start them on a mild treatment protocol, and then schedule a follow-up visit 1 month later. It's just as important to schedule that follow-up visit in order to evaluate their dry eye disease thoroughly. I'm prescribing you to use an ocular lubricant, a topical treatment, like eye drops, to manage the symptoms for now. It's an oil-based tear that you're going to use at night, kind of like putting lotion on your hands before you go to bed. I'd like to see you back in 2 weeks for some additional tests. During the next appointment, I'm going to do a thorough evaluation of your ocular surface. This diagnostic testing will further reveal the underlying cause of your dry eyes and severity, and that will help determine the most accurate next step of treatment for your condition. For now, in addition to the drops I've prescribed, I would like for you to follow these basic guidelines to manage your symptoms. Our receptionist will get you scheduled for your next visit. I look forward to seeing you in a couple weeks so we can get to the bottom of your condition.
Thank you.
Thank you for coming. Please join us for our next video program to learn more about the dry eye workup.